Okay, let's unpack this. Today, we're diving into something that's, well, incredibly personal for many people. It's often filled with emotions, so many questions. We're talking about the journey of trying to conceive after experiencing a pregnancy loss.
Yeah, it's a really difficult time. And for anyone navigating this, the decision about when to try again, it's
Hmm.
just loaded with uncertainty.
Mm-hmm.
And the medical advice on top of that, it can feel, overwhelming.
Right. And confusing, because what's challenging is just how varied that advice can actually be.
Exactly.
So that's really why we're here today. Our mission, if you like, is to try and cut through some of that noise, that confusion. We really want to pull out the key insights from an expert perspective to help you feel genuinely informed about conceiving after, say, a miscarriage or an abortion.
And we'll be drawing on specific medical guidance. This comes from Dr. Abiazim Chima M.D. of Mother Healthcare Owerri. He's offered some really clear advice on this exact subject. And just for clarity, he defines pregnancy loss as happening before 20 weeks. Or, alternatively, involving a fetus that weighs less than 500 grams.
Got it. And what's interesting, what sort of immediately jumps out, is Dr. Chima pointing out that this optimal time to conceive again, well, it isn't universally agreed upon at all.
No, not at all. You've got major medical bodies with quite different takes.
Okay.
Well, like the American College of Obstetricians and Gynecologists, ACOG, suggesting maybe just 2 weeks.
2 weeks. Wow.
And then that contrasts pretty sharply with the World Health Organization, the WHO. Their recommendation is 6 months.
6 months. Okay, that's a significant difference. 2 weeks versus 6 months. It really makes you wonder, why? Why such different views?
That's the critical question, isn't it? And Dr. Choma highlights that these different recommendations often come from, well, different medical priorities.
Oh, okay.
Some guidelines might focus very strictly on, say, rapid physical healing, getting back to a physical baseline quickly,
Right.
while others lean towards a broader view, a more holistic recovery, something that really takes emotional well-being into account, too.
That makes sense. Physical versus sort of whole person recovery.
Precisely. And what's really insightful here, maybe even, a bit revolutionary, is his mention that recent studies, they're actually suggesting the timing itself might not be the critical factor.
Really?
Yeah, the timing might not be what ultimately impacts the outcome of the next pregnancy.
Wow. Okay, that kind of changes everything, doesn't it?
It really does. It shifts the whole conversation. The focus moves away from just a rigid clock towards something more like individualized readiness.
That feels like a really profound shift in thinking. So if the timeline isn't the be-all and end-all, then what are the crucial things Dr. Chima emphasizes? What does this sort of comprehensive approach actually look like, in practice for someone going through this?
Yeah, good question. A key insight is that his advice isn't really about a one-size-fits-all waiting period. It's more like a set of crucial steps to consider.
Okay, like a checklist or...
Sort of.
Mhm.
First, he really emphasizes identifying the cause of the miscarriage, if possible.
Right. If you can find out why it happened.
Exactly. Understanding what went wrong, if you can, that's a really foundational first step.
Yeah, I can see how knowing the cause, even if it's difficult, could feel quite empowering moving forward. Give you some sense of control, maybe.
Precisely. Then, following that, he recommends managing any complications that might have come up from the loss itself.
Such as?
Well, things like making sure all the tissue has been cleared, or addressing any significant blood loss, just ensuring the physical recovery is on track.
Okay, makes sense. Physical complications first.
Then the next step he advises is addressing any underlying medical conditions you might have, things that could potentially affect a future pregnancy.
Ah, so looking beyond the loss itself to overall health.
Yes, it's really about making sure your body is as prepared and as healthy as it can possibly be for another pregnancy attempt.
These steps sound really crucial for, physical readiness. Does Dr. Chima also talk about the emotional side, the toll that pregnancy loss takes?
He absolutely does. Yeah, that's his fourth step, actually. He explicitly mentions allowing for both physical and emotional recovery.
Ah, that's so important.
It really is. It acknowledges just the profound impact loss has on a person's whole well-being, a vital part of readiness, and honestly, often overlooked.
Yeah, definitely. Okay, so cause, complications, underlying conditions, physical and emotional recovery. Is there a final step?
Yes, one more. Before actively trying to conceive again, he advises waiting for one normal menstrual cycle.
Okay. Why that specifically?
Well, it provides a pretty clear biological signal, doesn't it? It shows the body has sort of reset, return to a regular rhythm, and is likely biologically ready to support a new pregnancy.
Right, a biological green light, in a way.
We could say that, yeah.
So, putting this all together, what does this really mean for someone who's navigating this incredibly personal, difficult journey? It sounds like Dr. Chima is pushing for something much more individualized, more about well-rounded readiness rather than just hitting a date on a calendar.
That's exactly it. It really boils down to empowering you, the listener, with comprehensive information so you can make the best decision for your own unique situation. The focus shifts to genuine readiness, in all aspects, physical, medical, emotional.
Okay. So let's just quickly recap the main points from our deep dive today. We've seen that the medical advice out there on when to conceive after pregnancy loss, well, it varies a lot.
Quite widely.
You've got ACOG suggesting maybe 2 weeks, which seems very short to many.
Yeah.
And then the WHO recommending 6 months, a much longer time frame.
Right. But the crucial point, the really fascinating insight from Dr. Chima, is that recent studies are now questioning if that timing itself is the deciding factor for the outcome.
Which, as we said, really shifts the conversation.
Absolutely. And that leads us directly to Dr. Chima's own recommendation, which is much more comprehensive, more holistic. It's those 5 steps we walk through. Identify the cause if you can, manage any complications, address underlying medical issues, allow time for both physical and emotional recovery.
And finally, wait for one normal menstrual cycle.
Exactly. It just underscores that readiness isn't just one thing. It's multifaceted. It's deeply personal.
Ultimately, yeah, this whole approach seems to move way beyond just a rigid timeline. It focuses on true individual preparedness. So maybe a final thought for you, our listener, to sort of sit with is this. How might this shift in focus, this move away from fixed timelines towards a more personalized approach, one that centers on holistic recovery and your individual readiness, how might that actually empower people who are navigating this really deeply personal journey?
That's a powerful question to consider.